Good afternoon, ladies and gentlemen. So we are very happy to welcome you to this last session of our annual conference here in Dublin. We think we have an amazing panel today, so it's really a huge luxury, I think, to have these relevant players in the generic and biosimilar markets today for an open and transparent discussion on how we think, or how they think, basically, the future of the healthcare be and for our sector specifically. We have been talking about the past, about the impact of generics, about value-added medicines, about the Critical Medicines Alliance, about sustainability. So now it's the moment to, as we said yesterday at the beginning of the conference, to look forward in what the future will bring us. And for this, I'll start by introducing our panelists. So Pierluigi Antonelli, he's the CEO of Fresenius. He flew specially for this session, so thank you very much for coming. Markus, he's the CEO of the Polpharma Group. I have my co-moderator, Rebecca Guntern, who is the president for Sandoz Europe. Stephan Eder, who is the head of Europe's STADA. And Stephan Saltofte, who is the CEO of Zentiva. So I guess you agree with me that it's really a fantastic panel. And we would like really to tackle on a bit where we are today, what are the challenges besides what we have been also already been discussing, and which are the opportunities here and how that will shape or help us shape the future. So we will start by asking Pierluigi, what do you think are the biggest challenges facing the pharmaceutical industry today? And how do you see those challenges will influence the future?
Yes, and of course I will provide an angle which is also influenced from the company in which I work, right? So first of all, let me thank you and Adrian for the invitation, because it gave me the opportunity to meet former colleagues, some friends, and also some of my colleagues from Kabi that I don't see every day. I think I've been participating in the back this morning and part of yesterday, so there are very interesting exchanges and ideas, and I think there is a shared understanding of where we are moving as an industry. Having said that, we are on a very exciting road, but it's a road that leads to a crossroads. So I think we need to take some choices. I've been out of the genetic business for a few years, and I joined back Fresenius Kabi and Fresenius Group 1.5 years ago almost. But I see, with the exception of the ESG topics, which have become more relevant over the last few years, that the topics are pretty much similar to what I used to discuss when I was in Medicines for Europe some years ago. Now, as an industry, honestly, and I heard this also from other colleagues, we really cannot continue to deliver an ever-increasing number of products at a ever-decreasing prices. I think this is a contradiction which is totally irreconcilable. And as a mission, as a company, but I think our mission is very much shared by a lot of companies, we are here to, and all the 43,000 people that work in Fresenius Kabi are here with a clear mission, which is how to deliver affordable medicines to patients around the world. In Europe, we are 15,000, and we have 24 different plans in almost in every country within Europe. And the going is pretty tough, I have to say, right? And this is especially because there are regulations which are becoming more and more complex, especially for players who have a significant manufacturing footprint in Europe. We face increasing labor cost, more stringent regulatory requirements, and also environmental regulations, which they are all making sense in a certain way, but unfortunately they drive incremental costs, no? And we are in a situation where, honestly, we are between the rock and the hard place when it comes to ability to recoup the investments that we need to have. And therefore, it is pretty hard, and I see also that a specific topic has to do with the supply shortages. I think we all know why there are supply chains are very complicated. We operate in a very complicated, volatile market where sometimes we have very long supply chains, but also there is also an element of sustainability of the business in certain cases that we need to just admit. It is the case, right? In certain cases, we are not economical, right, in what we produce. And what I noticed in the past when I was participating to a meeting like this is that sometimes I perceive that some of us have some reservation to say that we are a for-profit company, right? That we are for-profit companies. Multinationals, when they are stock quoted, they can only continue to produce and invest and deliver affordable medicines in our sector if they drive a sufficient profit, which makes our shareholders willing to continue to invest or buy our shares. And if they don't do that, we are out of business, right? So I think we need to, while we are for delivering affordable medicines, and we do this, I think, overall, and not only us, but all of us participate in the industry every day, we need to consider that we need to drive acceptable returns. Now, what is the solution going forward? I think one is pretty straightforward, easy to say, less easy to deliver, which has to do with the revision of the pricing mechanisms, the way prices are set. And I understand that it is a responsibility of the individual countries. So I think but also it is something that we need to tackle with. I noticed that there have been certain changes and some decade-old legislations have been changed or modified, for example, in Portugal or in France, to increase price. And I think that's a step in the right direction. But honestly, we need to reset pricing policies in Europe in order to make sure that the production and the sustainability, reliability of our manufacturing footprint in Europe gets strengthened and is going to be there where the need will arise. And we need to stress to our stakeholders the importance of considering the whole pharma value chain, meaning in pharmaceutical there is R&D, there is manufacturing, and there is commercialization. And I think the individual initiatives which are taken by the governing bodies should be taken with the idea that they need to understand what are the implications of those initiatives on the entire value chain. It is difficult to imagine that a country can attract R&D investments, scientists in the vacuum, or attract investments in manufacturing plants and blue-collar labor without also creating the conditions for having an acceptable level of profitability in a country. And for multinationals, and this is something that we like it or not, globe is where we compete. And there is a possibility for me and my team, and my management team, to allocate resources in different parts of the globe. And of course, in pharmaceuticals, once you decide something, you're not going to revert it after a few years, right? Those are long-term decisions that are taken. So I think it's important that the decisions that are taken by stakeholders take into account. It's a very complex, as we saw this morning, very complex industry with ever-increasing regulations. And once a company decides what to do, it's not going to change its mind super fast. The second point has to do with parallel trade, which is absolutely legal in Europe, and I think nobody is disputing it. But I think it's also fair to say that when we see, exports of pharmaceuticals from low-price countries to high-price countries, this leads to shortages, right? And that's what a lot of countries in Central Eastern Europe, in Portugal, in Greece, have been experiencing so far. And we know why it happens, right? And we also know that these countries have also enacted some legislation to manage this flow of goods. So what I think it would make sense for us is the ability to be able to relabel our products, so to move products from one country to the other, similarly to what parallel traders can do. Nothing more, nothing less, just that, I mean, we can play exactly with the same rules. And then there is a third one, is the power of digitalization. Now, everybody these days, in every conference I've been participating on, people have been meeting, everybody speaks about artificial intelligence, because it's very fashionable. What I did is to spend over the last 3 to 4 months some time to really understand the applicability of use cases of artificial intelligence in our company, in our industry, and honestly, I am very amazed in certain cases the value added that we can get as an industry and as a company by leveraging artificial intelligence, which requires data. And pharmaceutical is an area where honestly is an industry where data are abundant. Now the issue is that we don't know how to get and gather this data and be able to manage those data, right? But 97% of data that are available here are not used. And where do we source this data? Certainly hospitals are a great place where you can actually get this data. Now, I believe that as an industry and as a company, now we have the responsibility of really make some distinct investments and choices on where artificial intelligence can be applied, because we will eventually allow us to produce more affordable medicines faster for the benefit of an increasing number of patients. I will stop saying that, no, we are at a crossroads. There are challenges. We need to make choices. There was a personal, one of you that made an intervention yesterday about the importance of speed. I think speed is of the essence. Also because we operate in a market, in a segment of the pharmaceutical market where honestly speed becomes an element of competitive advantage, and we need to decide and decide relatively fast. I think that, there are, what I would ask to the stakeholders is to make choices, understand the industry, what are the implications, the challenges, the opportunities, how important we are, which I honestly did not realize until I entered in this sector, because I started in the innovative part of the pharma, and then I moved after many years into the generic parts, biosimilar part. And therefore, when you deliver 70% of critical medicines, right, to patients, you realize what actually means driving access. So to the stakeholders, I would ask, take the right decisions, but please take them relatively fast. Because once again, we are speaking of competition, not across countries, but more between regions, right? US versus Europe versus China. And sometimes our interlocutors fail to understand that actually it's not France versus Germany versus Italy versus Portugal, but it's about Europe versus China, Europe versus India, Europe versus US. I'm confident that there is a heightened, especially after COVID, attention to the topic, and that the right decisions will be taken, please, with the appropriate speed. Thank you.
Very good. Thank you, Pierluigi. I think it was really a nice introduction with state of the nation. Where are we? What are the challenges you're seeing? And also some of the solutions. And before you get too relaxed, we're going to ask you also for questions. So think about what are the big, bold questions you would like to ask to this panel. You're going to have the opportunity pretty shortly. So Markus, I think we heard a lot about innovation. And fundamentally, of course, first and foremost, we're thinking about new technologies, product innovation, value-added medicines, which comes top of your mind. But thinking beyond, and I know you are one of the CEOs who inspire me all the time because you're pushing the button and really thinking out of the box. So if we would think about the companies and how do you see, could we do more when it comes to innovative ways of collaboration, partnerships, of course, always in a compliant way, new ways of working like digitalization, technologies? What are your thoughts? And most probably the question was to you, Do we do enough, or do you see we could do this much better or differently?
Thank you. And thank you for being here. It's always a pleasure to share my thoughts. And thank you for Pierluigi to kicking it off in such a good way. So I think it's a great base for what I want to say. Because, you know, we as companies, we really try to push the boundaries and how efficient we can be, how effective we can be, and all in the interest of the patient. I mean, access is our key priority, and we do it really every day with whatever we can do. Now, the question isn't that, and I like to be controversial as people know me, I was asking myself, can we do more? And can we really think the unthinkable question that we really could work together, cooperate, even being competitors, but really working together? And I think, yes, it's possible. And I would like to outline certain thoughts and what we have already done in Polpharma, also with other European companies, and I think where this could head. Because I think, and also here I have to open a quick bracket. I'm not coming from the pharmaceutical industry. I'm just having the pleasure since 8 years running one company, but I've been in different industries, and therefore I like to learn from different industries what we could do. Now, you see here certain statistics that, you know, for every product, more than 20 developments are done. Exactly the same developments, right? So the question is, do we really need this? Production, same thing, right? We all have production infrastructure. We also have 5 factories in Poland. Therefore, with the same, you know, issues you face, you know, increasing labor costs, increasing complexities, increasing environmental standards compared to our competitive in Southeast Asia. And obviously also on the commercial side, we also found that many companies are actually not competing. Yes, there are the big ones like, you know, yours, but there are others which are actually not competing. So we could actually work together without actually, you know, hurting ourselves. And in this context, I went on and looked at the value chain, which we actually, you know, work on. And we started with one project which we had, which we, and that's public, so that's why I can talk about it. I contacted the CEO of Aegis, Jabba, and I said, listen, you have invested strongly in cryogenic and high-potent infrastructure. I'm doing exactly the same. You do it in big scale. I do it in a smaller scale, more in the R&D side. Should we not work together? Because otherwise I have to, you know, build the next factory. This created a platform for cooperation where we first shared the industrial assets. Then we found out we can actually talk about our pipeline. And we found out we have the same products there. And there's so many molecules you can develop. We said, okay, why don't we actually, you know, not develop or co-develop certain of those products? So it extended into a co-development on APIs. And actually, you know, and obviously now we continue also next ideas which we have on this platform. So I think, so this is one of the key ideas which we had, and we actually made it work. Second idea which we had is, if you look at the automotive industry, they have procurement companies. There's one in Europe where all the automotive companies are a shareholder. I think there are 13 shareholders in the company, and they buy everything through that company. So why are we buying, and I'm not talking about API or sensitive, you know, matters. I talk about plastic, carton, you know, whatever you can buy, glass. In our production, we could do it together. And we're actually now talking to some of the companies which are here and seeing what we can do together in this context. In the beginning, you know, through some discussions, which we can do with contracts, potentially in the future with a procurement company, which then delivers value for all of us in this context. Going on, we are now actively discussing co-developments on oligonucleotides, which obviously, as you know, are quite substantial in terms of the investments, both on the R&D side, but also on the industrial side. Also, this looks very promising. And then obviously also on in-licensing, I'm a one European country company. I have Poland. So if I want to in-license a dossier, I have a problem. I'm most likely never competitive to colleagues which cover whole Europe. So then during one of our famous dinners, I had an idea and asked certain, I call them local champions, market leaders in European countries. Pierre Eki is also part, we have Polpharma, we have Dr. Energy and others. And we formed an alliance to in-license together for Europe. Today, we are larger than anybody else in the generics industry in Europe for in-licensing, in terms of revenue in those markets. And also, this is an approach which obviously you have to do in an effective way. You have to do it in a compliant way. I mean, we have issues with anti-monopoly, obviously, but we have lawyers teaching us how to do things. And then you have to execute in the right way. So I think also here, you know, there are the things we can do as an industry to become more agile, you know, increasing access. And then obviously also on the commercial side, right? We're now discussing with companies to use a strength we have in our markets, you know, to distribute the products. And we find out actually, you know, that they make more money and we make more money by distributing the products because of our sheer power in the market. So I think here also we can do more. But on top of it, and I think we heard it this morning, you know, on sustainability, or Pierluigi talked about artificial intelligence, or we talk about IT security, or we talk about, you know, education and learning. I think we as an industry could really do more also in this aspect to share. It doesn't have to be, you know, the real secrets of your business case in AI, right? But it has to be about bringing us forward as an industry. I think Medicines for Europe is starting to do, I think, really good job here. But I think we could also do more here by sharing. And funny enough, most of it works if you start at C-level, agreeing, because partnership is something new. So you have to push it through the organization. I have check-up calls every 6 weeks with Jabba from Aegis. And the two teams have to report what they did and where we can help them. And I tell you, there is progress. Because we check in for 15 minutes, 20 minutes every 6 weeks. And so it's very natural that then it starts flying at the outside. So I want to conclude on this in saying, yes, there is a huge pressure on us, huge, you know, increased regulations and complexities, but no, there's also something we can do more, and I invite you all. So we are open to do many things. Obviously, we're a private company, and we are quite flexible in this, but I also know that our friends from private equity-owned companies are open here to really make progress in these areas. So.
Thank you very much. So we heard about rethink pricing policies, having a holistic approach to the whole supply chain of our medicines, use AI to become more efficient and probably also reduce waste and environmental impact, and several angles of cooperation as co-developments, co-in-licensing, co-procurement, and co-distribution, besides sharing knowledge or insights. I think it's really a lot of different proposals, but I would like to ask our two Stephan panel at the other side of the stage. Would you have additional ideas to this list?
I'll start. Thanks, Stephan. No, I think it's important, right? So the industry has a couple of elephants in the room. I think both of my colleagues here alluded to it. One probably stands out bigger than everything else, which is the pricing piece, right? And we almost excuse ourselves to talk about it. But I think what we're missing out on is that is actually the fundamental piece of how this is going to operate. The second piece that I think we are coming to during the course of this session is on the regulatory environment, right? So we are not a US single sort of market, single sort of regulatory setup. We are 27 different countries that more and more, especially after COVID, shortage, all of that, acts independently and works independently. I'll give you a short example from my neck of the woods. In Czech Republic, we have life-saving medicines. We have a price of 0.17 euros a dose. 0.17 euro a dose. 1 cup of coffee, Starbucks, in Czech Republic is $2. There's no way that the fundamentals of that can work. So I think we have to sort of be very specific on the topics that we work on. I think Pierluigi definitely alluded to it. Markus is already ahead of all of us by creating partnerships to sort of balance that out and accelerate that, right? But those two areas for me are the most important. And if we don't settle that, we are not going to settle the future. We've been around for 30 years in Medicines for Europe. The progression that has been done in the generics industry, for those of you who have been here since day one, it's absolutely phenomenal. It's really, 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 really progression. But we're coming, in my world at least, to a little bit of a dilemma or sort of against each other, whatever you call that in English. And that is that the fundamentals of the healthcare system has to change. and has to move towards where we are. Otherwise, I would almost guarantee that we continue to see more shortages, more critical medicines, longer lists, and all of that if we cannot sort of handle this on our own. And I think that's a bit the debate that we need to have. I think we probably need to be a little bit firmer around it. We found our ways in terms of partnerships, in terms of working together, even though we compete on a daily basis. We're still companies that has to bring accessible and affordable medicines to patients, right? So I'll leave it here and hand it to you, Steffen. Maybe you also have a couple of points.
Yeah, thanks a lot. So maybe on the point that Pierluigi said, that we are at a crossroads. I think indeed we are at a crossroads, and this was also very evident throughout the entire conference. And I think we have broad alignment across the stakeholders that indeed we are at a crossroads. And as you also said, essentially we are a for-profit industry, and there is nothing that we need to hide for. And this also here, I think the dialogue has shifted a little bit. If I look 5 years back and I spoke to payers, essentially they did not accept that we actually also have a profit motive. But indeed, in order to have a sustainable market that secures supply for patients, which is really our ultimate objective, we need to have a strong industry. And I think this realization promises great potential because it attracts investment, it attracts money, and actually that is what secures supply. And then when it comes to collaborations, if I look just at the industry participants here, well, actually our company, STADA, is collaborating with most, if not all of them here, as well as if I look into the room. So I think we have a lot of things in common. And also the voice of the industry is a super strong one. And again, brings me back to my first point. The stars are aligning. I think we are being heard. And I'll elaborate a little bit more on this later then as well.
Can I just, because the beauty of our Europe is that we have a very strong pharmaceutical setup, right? Because it's easy to say, yeah, I want to become a powerhouse in software, right? But honestly, do we have champions in software in Europe? We don't. Therefore, it's going to be very complicated to drive investments to become to match what happens in the States. But here in pharmaceuticals, we can still compete, although we're not as strong as the US companies. We can still compete globally. And what I would say is it is time for the European Commission and the Parliament to realize that there is a strong foundation on which you can build further, right? And then you need to understand how we can do it in a way that drives the individual pieces of the value chain so that we can actually have a say and count even more in the foreseeable future within, because it's an R&D intensive, there is a high, strong portion of manufacturing, blue collar, right? And there is, of course, a market that needs to exist. So it's very well, balanced value chain across the board.
Mm-hmm. Let me build on, sorry, do you mind if I build on that before we go on?
Yes, sure, absolutely.
No, so I think you're right, Pierluigi. I think the point here, I mean, having spent 2 days here, been sort of 6 months in medicines for Europe, one thing that we don't talk a lot about is how do you enable businesses? We talk a lot about policy making and regulators. And this is still a bit new for me, certainly to play in this type of mechanisms of medicines for Europe and other things. And I'm missing the debate to enable, I think we all here feel very European citizen. How do we combine the conversation of actually bringing businesses forward in areas, to your point, where we are very strong? And certainly pharmaceuticals in Europe, I mean, I'm Danish, I don't need to remind anyone what kind of pharmaceutical industry we have in Denmark, right? So we need to also change that dynamic because otherwise it always continues to be regulations, policies, you can do this, you can't do this. Now I'm fully behind, you saw Ines earlier today, fully behind taking care of the planet, doing it in a sustainable way, driving that forward. I don't think anyone here is against that. But we also need to have conversations that takes us out of just, here's a rule, follow it or not, right? Here's a policy, follow it or not, pay for it, you need to help us upgrade our energy systems, you need to help upgrade this and this and this. And I think we need to take a little bit of a firmer conversation there as well. This is something that surprised me a little bit in not just the last couple of days, but following European politics for a while, right?
So would you say there's an opportunity? Because I was just thinking when you were saying about this life-saving products, and we have a similar case, as you know, with anti-infectives, right? Where we see in Germany a pack of 10 tablets of anti-infectives, life-saving treatments, is less than €1, right? So you could ask yourself, who wants to invest? I mean, fundamentally, the economical viable proposition is not anymore working, right? Nobody would invest into this, and nobody most probably would produce it. But I think we have been there. So would you say we need to be louder? We need to talk more about the value versus the price? Or what would you say we need to do differently? Because I think we have now a very unique moment that this is the first time, and I'm 70 years in this industry, that I do have really discussions where people, I believe, at least start to understand, you know, that there is a tipping point and there is I would say, no way, return way. So what would you say? What do we need to do differently or more?
Markus, do you want to go first?
Yeah, thank you. I think the question is, are we talking to the right people? You know, because at the end of the day, it's the patient. And the question for me, and we always talk to politicians which are elected for a year, sorry for being so blunt. I mean, and the investment horizon for what we're doing is way about 4 years. So whatever we do is long-term, it's major investments, it's new technologies, it's R&D, and that just is a longer time period. So whatever they do most likely has a focus of 4 years, which is basically the time of the records. And the question which I'm asking, you know, also to the whole audience is actually, should we not, you know, communicate more also to the patient, which is then basically then also building up, because he's the one in need. He's feeling the, you know, the stock issues, stock outs, and so forth, and not the politician himself, right? So I think the question is, are we communicating in the right way also to the wider audience, in the right way, obviously, by the way. So.
Good. So this is a perfect handover to actually Steffen, because now let's look. I think we understood the challenges. They're obvious, but I believe the opportunities are equally big. So Steffen, if you would think about the role of the industry in the future and how do we shape the future as an industry, looking at all the trends, and they're significant, some of them impacting most probably our midterm outlook. So how do we respond? What is the answer we have?
And actually, I think I like a lot what you said, Markus, that we should speak to the patient. I think I'd like to show a slide if it were possible. If not, I will just speak to it. At STADA, we do what we call an annual health report, and we have it's a big multi-country survey where we actually do not speak to regulators or to healthcare professionals, but we speak to patients. So for this year's health report, we spoke to more than 40,000 patients in 23 countries, and we gathered their opinions on various topics. And you could look at the glass half full or also half empty. What did we find out? In terms of healthcare, that many patients do not do anything in terms of preventative health. Yeah? That we also saw that there is an erosion in the trust of healthcare systems over the last 5 years from 70% to 60%. Equally, we saw that patients are concerned with security of supply. And that is also why politicians take this seriously, because in the end, politicians are elected by people. And we also see that, of course, there is support for new technology, such things as e-prescriptions. 80% of patients are in favor of electronic patient information leaflets. And only 14% say that we want to have both, a written one and an electronic one. So there is, and of course there are concerns with data privacy when it comes to e-prescriptions. But I would say we can look at this as it's all doom and gloom and, you know, trust is eroding. But equally we can look at this as a huge opportunity for us. STADA, we are a company that is not only active in the field of generics and biosimilars, but we, I would say, wider the entire off-patent spectrum of healthcare. We have food supplements, we have OTC medicines, and we have primary and secondary care prescription medicines off patent and partially also niche patented products. And if we look at generics, as you said earlier, Markus and Pierluigi, 70% of the volume is generics. If we include also OTC medicines and food supplements, I don't have the data, but probably it will be rather 95%. So we as an industry are really having the health of Europeans in our hands. And I think that's a very noble mission. That is, for me, one of the reasons why I really love to be in this industry, because we do something very, very important. And then Europe has, of course, very different healthcare systems, and I think this was also admitted in the discussion so far. The European Union can and shall not regulate everything, but indeed we also believe in the member states having their responsibilities, because healthcare systems are core to how member states actually define themselves, and everybody has a slightly different approach to this. But equally, the European Union can do a lot in terms of administrative ease. Such things as patient information leaflets, we can discuss for the next 15 years until the cows come home, or we can just do it. It's the same as when you say you have organ transplantation. You have countries who have an opt-in system and countries who have an opt-out system. You can debate forever, but as soon as you have an opt-out system, the number of organ donations goes up dramatically and you save patients' lives. I would see it similar with patient information leaflets, with moving product between countries, or avoiding single country, not really mechanisms that underpin European solidarity, where we have stockpiling requirements. But equally, and I would say this is, the key is for us, we as an industry can be self-confident, that we also speak not only with patients, but also with regulators, with patient organizations, but also with clinicians to make our cause heard, because in the end, Europeans depend day in and day out on what we do. And I think we have here, as I said before, the stars are aligned. Now is the right time and the right moment.
So if we look again at the future, and it has at the future of healthcare, and we have Pierluigi has mentioned about Europe and the strengths we already have. If we compare to other continents, we have a very protective healthcare system, generally speaking, in Europe, because at the end of the day, most countries have some sort of coverage for the patients, while in other countries, which we admire for many other reasons, patients do not have this security. So if we look into Europe, what key areas should we leverage? Which are our strengths and which should be proud of? And which expertise we could sort of continue strengthen and use to make Europe more competitive to what it currently is?
I think I'm going to try and tie it into 3 areas. But actually, I will start with the conclusion and probably finish with that again. So for me, the conclusion is healthcare is a right in Europe. It has to be accessible and it has to be affordable. I think when you look at all member states, every single country in Europe, we all have a belief that healthcare is a right. I have an aging father. He's well up in his years. He has an accident 2 years ago. He fell, broke his neck. He's getting medicine. He goes to the local pharmacy. He lives in the middle of nowhere. Comes up. He's very proud. He sends me a box. It says Zentiva. I said, okay, impressive. But he sends me also a box that says STADA. Okay. But it's not done there, right? He has one with Fresenius Kabi as well, and he has one with Sandoz. So he gets 4 boxes, and he pays less than €1 for those 4 boxes. Now, I think somehow that's a challenge for us, but somehow we can be very proud that somebody who lives in a village that is lucky enough to have a pharmacy can actually get medicines for such important players. So I think for me, the conclusion is clear. It is a right, and we have to make sure that it is accessible and affordable. Now, answering your question, Elisabeth, for me, I think we can be really proud. We have a tendency to be, it's easy to be pessimistic about the industry. It's easy to talk about the negative things, right? But I think when you look at the volume that comes from generics in Europe is 70% of total volume. So I'll be as blunt and say there is no healthcare system in Europe if there's no generics. It's just not going to be there, right? And I think we've proven that. You look it through COVID, who saved the butt of most? The generic systems, right? You just basic medicine were coming in and out of the system, and we were doing that. And we were getting it fast, and we can argue for a long time about manufacturing in Europe, manufacturing outside of Europe, but because we had solid manufacturing sites that could accelerate fast in Europe, we definitely delivered, and we continued to deliver. So in those setups, we do, and we will continue to do. So I think number 5, the first point of the 3 that I have is resilience. The second point for me is the regulatory environment. I talked a little bit about it before. I commented on the pricing piece. I talked a little bit about the regulatory environment. It's not always particularly helpful, right? It is really set up for cost. You have a lot of tender products. You had a lot of reference pricing, so everything is set up to drive prices down. I gave the example of Czech Republic of life-saving medicines. This cannot continue. If this continues, I guarantee that we continue to see more shortages. And that's not a good thing for patients, but also for us, because what are we talking about? The third elephant in the room is around stockpiling. So we spent a lot of time, trying to sort of, what is stockpiling, how much, what are the countries doing, and so on. But I think we are missing an aspect of that conversation as well, which we can do it. I don't think there's enough capacity in Europe to commit to these countries. Where we were talking to the Commission a couple of weeks back in Brussels, I said the same thing to one of the health ministers. If a couple of the big countries really forces this through of 6 months stockpiling on every product, you won't get medicine in your country. It's as simple as that. The capacity is just not there to deliver that. Now, on top of that, what's the consequence if the medicine doesn't get used? It's going to get thrown out. So not only do we spend a lot of energy and efforts and activities to produce it, but at the end we end up, throwing out half or so. So we create more pressure on the planet, coming back to our ESG conversation before. So I think we have to look at it in a different way. And we all appreciate and understand the budget constraints and all of these kind of things. So for me, the second point is regulations. And then the third point, I will build on what Markus said before. And this is very important, collaboration. You see 4 companies, 5 companies, 6 companies up here. While we are competitors somehow on a daily basis, there's still a need for the industry to collaborate. Not for each and every company here, but for the patient. And if we don't collaborate across, it's not going to work. You can collaborate company to company. You can do company to public. Some of us, if not all of us, we probably have virtual collaborations with universities. In Czech Republic, we have something called the Park, and we help educate people there, and I'm sure all the other companies have those types of things as well, right? So for me, this is really important, that we do not see ourselves as a single source profit optimizer in Europe, and we do not put ourselves in the same sort of categories as regulators, where we have 27 different systems. We do have 27 different companies, but we're sitting here for a reason today. And I will finish with the conclusion. The reason for me for sitting here today is that health is a right in Europe. It has to be accessible and affordable.
Very good, thank you. I think it's super inspiring. Honestly, I love this, that access is actually not a privilege depending where you live, the age you have, the nationality, but it should be fundamental, a basic right. And still we're seeing a huge gap in access, right? I mean, even in Europe, you don't need to go outside of Europe. Beyond generics and biosimilars, the gap is even bigger. Biological treatments, the further east you go, there's almost no access or very limited compared with Western Europe. So there's still a lot of work to be done. And you know what I liked also what you said on affordability, accessibility. This is totally in line actually with the pharma review. Because the pharma review really looks now, how do we drive the future of the European healthcare system when it comes to availability, affordability. And I think this is totally where everybody can benefit, the industry. And I think that's why we're a huge alliance in the entire review, and most probably also for the future of healthcare. So looking at the gentlemen on the right side, how do you feel about this access gap? What needs to be done, in your view?
First of all, I think having worked in the US, but also in different countries in Europe, and also having significant markets in Asia-Pac, we are fortunate as European citizens. We don't realize it. I mean, you probably realize it only when you travel and you see how the access in other countries is. So I think we are super fortunate, and healthcare is a right here, which is not in many other countries, including some very developed countries. I want to build on what you said, Stephan. What should be happening? Because some of the topics we discussed have been here for and I think this is what we are doing, right, as an association. But I wonder whether we could honestly further strengthen and simplify what we think is essential as an industry between the Medicines for Europe and the local pharmaceutical pharma associations. What do we need to fight for and work in a further, more aligned fashion moving forward, instead of trying to steer the issues depending on the countries in which we play, because that's a reality, right? Sometimes, there is a little bit of a deviation, and people need to understand that even a big country within Europe will not be able to compete or to do things for its own benefit. And this is something that politicians are now also considering sometimes the nationalistic, drive that we see also in national elections. We don't understand sometimes the importance of alliance rather than I do what I can for my country. So stockpiling, I want 6 months in my country, and who cares about the others? We gotta be finding ways to simplify what we want in terms of simplification, right? In terms of standardization, in terms of harmonization, in terms of digitalization. Because there is a tendency also within our companies, right? And many times I discuss, I have here our head of Europe for Fresenius Kabi, Mark, and we discuss what do we need to do as a company to drive fewer things but more unified across Europe, instead of every country wanting to do something differently. So that's a disease we have also within our companies, and therefore we gotta fight it within our companies, but also make sure that politicians understand it. And then I would say it's about, I said digitalization, harmonization. What do we fight for? What would be essential moving forward for us to be able to continue to drive affordable healthcare? How do we change the criteria for tenders so that it's not going to be just price, it's a security of supply, it's environmental criteria, is, for example, do I produce in this region? Because if I produce in this region, I make investment in this region, right? And I play with the rules that also the community, the European community asks. So, there are different standards across the world, honestly speaking, right? And it's funny, when I was discussing with another big company CEO, he told me, and I was a bit surprised, and I said, no, I don't agree. He said, US is innovation, Europe is bureaucracy, Asia Pacific, China is speed. And of course, we were debating. But that's the perception that people outside of Europe have, which is a mistake, I believe. Yeah. And then I would say also, rewarding, as I said, people who are companies that are manufacturing in this region. Those are things that we can, identify which makes a difference, few things, and fight for those in a aligned fashion between Medicines for Europe and the local national associations with the support of the companies that are here.
Markus?
Yeah, so I would like to explore this in 2 dimensions. One dimension is, that obviously drugs are 10 to 15% of total costs of the healthcare system. Now, if we talk about digitalization, I think it's not only us. It's the overall end-to-end system which has to change. And I think, and especially in that context, AI and so becomes a totally different, animal, because there you really then have the big data. There you can drive the efficiencies when you really go end-to-end. And I think this we have to fight for, that it's not only us always this limited factor which is squeezed, pushed, and we have to be more effective, but really look at the overall, let's call it total cost of ownership, to have this right for healthcare, right? It's not only right for drugs, but really right for health. And the second is, I think, and that has to do, again, with the statement I made before about, the 4-year term of a politician. I do think that we could dramatically reduce healthcare costs by prevention, by education. If you look at, the aging population, obesity, and other developments which are dramatic, right, and which not only happen in the US, but which happen in front of our doors right now. And I think because, the fast food is cheaper or drinks with sugar are cheaper than water or whatever. I mean, all these aspects which are just driving the wrong motivation. And people which have less to spend, they obviously go for the cheaper food, and then you have the whole system which goes in the wrong direction. I think here also we need to have, on the preventive side, we really need to have more investment, and I think it starts with education. It starts at schools. It starts, the whole, and also for the aging population, also there, we need to educate. You have to stay, healthy. You have to exercise, and. So I think in this context, that's what I would say. Additionally, which were two aspects which really, push forward. Again, in the interest of the patient, because I think it really helps.
Mm. That's really true. And I would say the first thing is that they avoid to do mistakes like the stockpiling, because that's definitely not going to drive and close the access gap so far. So, Elisabeth, I don't know, are you ready with your question? You want to most probably have the opportunity to ask. James, I see James.
James.
Just to keep it lively. Look, a couple of observations before a question. We've heard a lot over the last 2 days about how pricing is a national competency, but there's a bit of a dissonance, and you see it with the stockouts, and that's parallel trade. How can you effectively import one country's price system to another via parallel trade? And it clearly, I've had it happen to me, is a trigger point for some shortages. We're currently in a dispute with the Spanish authorities for being fined for the privilege of having our stock taken from Spain and us being out of stock as a result of it. So my question to the panel is it time to start lobbying for a suspension of parallel trade on pharmaceuticals as part of the solution to shortages? Does anyone see that as a viable option?
Who wants to respond?
I think it's a discussion that we should have as an industry with the European authorities.
Myself, I think if we can play with the same rules, that will also, frankly speaking, without trying to challenge something which I believe is legal, right? I'm convinced it's legal, but if we can just have exactly the same opportunities as parallel traders, that would be already a significant step forward.
But no, I would actually add, where we have constraints, I see it in two ways, right? Legally, it's allowed. You cannot stop this. But where we have constraints and we see this in biosimilars, that patients are really not getting the treatment because the product is being shipped to another country where we have enough stock, by the way, then it harms and has an impact which is negative for patients. And there I believe we need to do the case, right? Fundamentally, if we have constrained supply, this needs to happen, and the borders needs not to be open for parallel trade because there is no patient need in the other countries.
But I agree with Rebecca here. I mean, your example, James, that's ridiculous. I mean, it's as straightforward, right? How can you be fined for somebody taking your product and you get out of stock? We also see, Peter is here from the Danish Association, right? So some of these parallel importers, there was and correct me if I'm wrong here, Peter, right? But there was a legislation gone through in the last, 2, 3, 4 weeks, right? Where everybody else has to stockpile, but not parallel importers. So thank you very much. You can freely move goods across 27 countries, and even more if you want, but you're not limited to the rules of the game. That just absolutely doesn't work. Like it's like having your old big brother again one more time, and that just doesn't work, right? That function, So I think there's two elements in this, right? There's your element which just needs to stop. That's ridiculous. The other thing is, of course, you can't encourage even more parallel import because they have the mechanisms of filling because they know how to do that versus somebody who's actually producing specifically and packaging specifically for a market and being on top of that reduced to a stockpiling system. So we definitely have a conversation there. I think the conversation though for me is bigger Because it's not just about moving goods around, or that it comes back to stockpiling, but stockpiling comes from another reason, right? And I'm not going to sit here and preach prices for the rest of the afternoon, but there are fundamental things that everybody's trying to optimize, right? There's a reason why parallel importers' margin is much lower than everybody else's, because they need to sort of do it as trading. I think we have to come back to what Pierluigi said. What are the 3-4 fundamentals that we can influence and work on? And that's it, right? And we've seen where we work better than others. We sit on 70% of the volume. Now, we should be able to use that in terms of making sure patients get medicines at the right time, at the right price, and. And so I feel very strongly about this. It's not just a price point, but what we saw here from the ESG with Ines and the team, right? I mean, every single country has their own access into us. Some are saying environment, some are saying other things, and some are saying other things, right? And I think if you don't fundamentally change the rules of the playbook, you will continue to be fined in Spain. Sorry for that, James, but that's how it's going to be. Yeah.
I think there is another one.
Thank you. I was thinking about misinformation and sometimes also issue of trust with patients and public. Do you see a role maybe also for the national trade organizations to be more out there and explicit on what the generics bring and the challenges that we are trying to solve?
Stephan, you want to take this?
Yeah, for sure. I mean, I would say if you look at how we as an industry have evolved, indeed it was from a non-industry because it didn't exist a few decades ago. And then there was also concern about actually generics of the same quality as the reference products that they were being substituted for. I think as an industry we have largely done a very good job in educating the medical practitioners as well as patients of the high quality of our medicines. And that's what we also see consistently in data. Of course, there is variances, say from west to east and probably also from north to south in Europe. So there's probably still work to be done. And we also see that the generic penetration in countries such as Italy is far below the generic penetration, say, in the Nordics. And there is still work to be done. Yeah? And maybe also it has to do with how we position ourselves, being named as generic, as so to say. It's a little bit like the little brother to something that is the big brother, and you really want the big brother. I heard once a physician say, a biosimilar rituximab. So I take the original for my mother, and the biosimilar I take for my mother-in-law. And that is a little bit still sometimes the perception, and it's horrible. But so there's still, I think, some work to be done. But also, as you see with biosimilars, I was shocked, but I mean, that's what the guy said to me.
Some have a good relationship.
I'm not going to say that at home,
just to clarify.
What's going to happen in the big case?
He was not speaking about my mother-in-law. He was speaking about his mother-in-law.
Yeah, of course.
He doesn't know my mother-in-law, So,
well, now he does.
It was 5 years ago, so he still doesn't. Anyway, long story short, I think with biosimilars, we have actually made a very strong case for what we stand for in this industry, because as Rebecca has said, access has gone up dramatically. I think such case studies we can use because patients get now prescribed a biosimilar medicine much earlier, and it prevents disease progression or the onset of disease, and this is a fantastic, it's a fantastic thing. My mother also gets a biosimilar teriparatide, I'm proud to say from STADA. But she would probably not have been prescribed 10 years ago because of cost reasons.
No, absolutely.
I would have a question to the audience. Who thinks we should communicate differently? Because obviously, we're all, most of the members here, who thinks we should communicate differently? You go more openly to the patients, as you say, not be the generic small brother, but we talk about what we're doing well. And just a question: who will communicate differently?
Yeah, sure. Always communication. Okay.
Like a 20-30%? Oh, Adrian, so
Fresenius is communicating.
No, but I liked yesterday with the IQVIA presentation. In any case, I thought it was fantastic, spot on what we are actually trying to shape and to communicate. And I think there was a slide which really got my attention, is the value, right? So it's not a cheap medicines. Let's never ever talk about cheap medicines. This is, if I hear it, I get quite some emotions. No, but I think we're here to really drive high quality medicines, and let's not talk about this cheap stuff. And I think it's value, right? We need to better explain the value. I hope it's not too philosophical, because at the end of the day, everybody needs to understand what we mean, but I think there's a job we can do. So there's so much value with the biosimilars. You're absolutely right. The numbers are impressive, so to say. Good. Some other, I think we're starting to get a bit more energy, so some other good questions. Yes. Yeah, that's going to be a great one. I see this coming.
Thank you for the confidence. I'm not sure whether I can live up to that, but thank you for the attention. I would just like to, what Steffen said about Denmark. It's true that we now have a law on stockpiling, and it's also true that the parallel importers managed to get an exemption. But the story is even better. They have managed, and this is a great public affairs job, they have managed to paint themselves as a knight on the white horse who comes in whenever there is a problem with supply. Then the parallel importers comes to the rescue. Nobody asks questions where they get their products from. You all know Novo Nordic, right? They have these huge sellers in Denmark, which are supposed to help people with diabetes and being overweight. Two different products, which are exactly the same, but they were. Most of that was sold in Denmark last year was Novo products, but they were almost all parallel imported. Nobody in Denmark knows anything about this. The parallel importers are extremely good at public affairs. So I'm just going to say there are a lot of challenges ahead, and we're talking about the future. We need to be as good as they are in telling the right story and using the right words. They have done a remarkable job. Even the head of the Danish Medicines Agency said that it was the parallel importers who helped us get through COVID-19. I mean, Jesus Christ, I mean, when you listen to things like that, that's the highest authority in the country who actually believes that. I just have to say, my colleague from the parallel importers are so much better at public affairs than I am. So there you are. Sorry about that. No, but I think we really have a challenge for the future there.
Yeah, but this happens always, right? I think, honestly, because it's a repetitive, event. And maybe it's because I'm a manager that I tend to go into, okay, what do we do about it? We have capable people, right, in all different trade local associations, and we have general managers of many companies, generic companies in all the different markets, people who are having R&D plans, and they also have commercial infrastructure. Instead of discussing, because that's also one of the topics that a classic topic in Europe, right? We like to debate. I come from Italy, you come from Germany, Denmark, everybody thinks that individually we are more intelligent than the others. We gotta be creating alliances and work together. And I think we need to be finding a minimum common denominator, which are the 3-4 things that we are fighting for. Pool all the national association with Medicines for Europe, and the members of Medicines for Europe are also the members of the individual trade local associations. And we put together an action plan on which are the priorities, what is the communication plan, what is exactly that we're going to be telling in every single country, who is going to be meeting whom by when, politicians, patient associations, and stick with it for a lot of time. Because, of course, the politicians change, but also people in the commission, they stick. I mean, people in the offices are always the same. Typically, they don't change with politicians, right? I think this is the part that actually is within our control if we want to. Otherwise, we continue to debate stockpiling, pricing, harmonization. I think we need to find a way to work in a more cohesive fashion moving forward. And it will not be solved in 6 months, it will take longer, but there's where we need a goodwill from different stakeholders also within our industry to be able that we get heard as manufacturers which deliver 70% of medicines in Europe.
Hi, thanks for taking my question. Given regulated prices, do you think the industry can absorb the costs of the Wastewater Management Directive? Or do you think it will result in industry margin pressure?
If we would know the answer, most probably, who would like... No, listen, we had a long discussion, I think, in the board yesterday, and I think the first parameter we need to understand what is actually the real cost, right? Because there's a lot of models out there, and we need to understand this almost market by market on how much it is and what is going to be the model, who has to pay, and then fundamentally, is there a way that we can reflect this in pricing models and regulations we currently have? But it's huge. I mean, we are looking at big numbers, and fundamentally, we have big volumes as well, and I think that's the challenge we're going to need to solve together, most probably state by state. I don't know whether somebody wants to add.
I think Rebecca is right? I mean, the first thing is to understand what it really is. Otherwise, it would just be a guess answer. But what we are seeing today, I agree, it is a sizable, right? I don't think any industry could absorb that without a big hit. And we talk a lot about sort of that manufacturing setup that we have, the benefits of that. We've seen it live, right? You're going to have an impact on that setup if you continue to drive it at the level we see it now. But I think it's unfair for the 6 of us sitting up here saying yes or no to that when we still need to work through it.
Yeah, maybe on the communication point, whether it comes to this water directive or whether it comes to the parallel traders, I mean, one of the things I think I can congratulate the companies up here, but also the companies in this room, is that we are a transparent industry. So the reasons why the parallel traders get away with murder in Denmark on this new legislation is because they advocate for opacity, no transparency. They don't want anybody to know anything. They don't want anyone to know that it's Bulgarians helping the Danes. Well, who needs better access to medicine, Bulgaria or Denmark, right? And they are trying to keep all of this concealed. So I think our transparent approach that we're willing to give to the Commission, to the member states, whatever they ask for. Sometimes it's very painful for people in this room because we're transparent, because we're here to fix problems. That's the difference. And so I guess one of the questions I'd like to ask to the CEOs is, how can we leverage the fact that we are totally transparent, totally open to all governments in Europe to make these cases? And then we can communicate, then we can work. What else can we do to showcase this? Because I really think you can ask the people who work for you how many times I go to them and ask them for data to give to the EMA, to give to all these people. We always give it. We always are open. And I think if we continue with this, an open society, a transparent society, in the end, will win. And so what can we do to leverage this in a better way? And Markus, you're focused on this data and things. How do we get this data? How do we get your data more out there?
Yeah, I think I come back to the same question. Are we talking to the right audience, right? Are we really, because we communicate, as you say, we are transparently giving data out there, and as Pierluigi said, data just supports a cause or an action you have, right? And we need to be very coordinated, I suppose, with what we want to achieve now, and I think it's especially the wastewater initiative. I think that's exactly one now where we see a massive impact. We have flagged it, not to the public, but to the authorities. They haven't listened, it went through, and now we face the consequences, which will be dramatic, as we all know. And we don't know exactly what the costs are, because nobody has a clear estimate, and so forth. Therefore, we can also not say how much cost we will have to absorb, or how much it will impact access to medication, and so forth. So I think it's And that's my question to. That's why I also said before. You know, I think we have to go wider and potentially in a different way in terms of those topics which are coming back. You know, again and again. And as you say, we are a fair and supportive player of the system, but sometimes others play it differently, right? And suppose we have to also play it in a different way. You know, addressing all the stakeholders.
Maybe also an additional reflection, whom to speak to and how to speak to. We, as you said, we are very transparent and also nuanced. And I personally believe this is very helpful because in the end, this helps then policymakers also to make really good policy. However, if sometimes you face other stakeholders who have a very simple message and everybody sings from the same hymn sheet, then it becomes partially challenging. So take this case of parallel import, we solve shortages. A very compelling message. Or from innovators, we need longer IP protection because we want innovation. There's little nuances in there, and sometimes when we have a more, say, less clear-cut approach, that might put us at a disadvantage. I still believe, though, in the long term, it's right because we create trust, and with the transparency, we even further advance this trust.
Yeah, I would say I agree with you at the trust point, and I think we got feedback from EMA, for example, when we tried to understand and predict the season 24-25 in flu, that have been extremely helpful. So I think it creates trust, and trust always needs time. So this is a good thing to do. You know, I get a lot of data myself because you say on the operations, right? And sometimes I get so much data that honestly I'm confused because I'm losing the bigger picture, and the question is, so what, right? Because I get reports for market shares around Europe and I'm lost in translation. So I think if we talk about data, I would say simplicity, what you were mentioning, and the second one is the source of data, because I come back to my IQVIA experience, and I think I'm not paid by IQVIA, but you know, it's so powerful because it doesn't come from Sandoz. So if I go and then present the Sandoz numbers, it always has the flavor of, well, what does she really want? And is there a hidden agenda? I think we need to use more sources which are neutral. And I thought yesterday's was super powerful in terms of numbers, what we have achieved, reducing from 40 to 70%. And it's fantastic. If somebody asks, we should really send him on a tour, because I think the 6 slides, they make it. It's for me, pharma review at its best. So, you know, Adrian, to come back, I don't think we need more data. Most probably we need clear messages compared or linked to the data, and then who is also translating. It's not always us which have the biggest impact. We can provide it, but I think that would be my couple of thoughts.
Sorry, go ahead.
Yeah, if I may add, and I admit I speak from the B2B perspective, but you were discussing about parallel trading. You asked about the urban wastewater regulation. I think at the end of the day, it relates to what Pierluigi said at the very beginning. We are lacking the holistic approach because the laws were designed maybe 25 or 30 years ago with one specific goal in mind. So free trade of products. And on the greener side, someone thought, okay, let's have pharmaceuticals pay for how much they contaminate the water without thinking, without having really the whole picture of how this affects the different industries. And we have many examples of this. You all know there is this PFAS threat on pharmaceuticals, but not only pharmaceuticals, also on the equipment we use to manufacture pharmaceuticals. So one of the things I think Europe lacks, and I'm still extremely proud of being European, is having this holistic approach of how one regulation really affects the key sectors and has the end-to-end, as you were saying, with digitalization, the end-to-end view. Because it looks a bit from the outside like everyone wants to rule his piece of the cake without noticing that the cake has some cuts, but also lots of different layers underneath. So this holistic approach would be extremely helpful in many of the challenges I think our industry is facing right now.
I think you've done a good job, Adrian, and Medicines for Europe, right? Because what is it you help us with? You help us join up. If you weren't here, we would all do individual things, right? But we are stronger as a team, despite we compete. We don't talk about what we do, and we don't talk business, right? You say that to us every time. But I think we're all here for the same purpose. So the purpose, whatever way we turn it, every company here probably has a similar or the same purpose. It's all about health and well-being to generations. It's all about accessible medicine, affordable medicine, those kind of things, right? If you look at the panel here today, I think every one of us has probably made one or two strategies before, right? And what is it we start with? Simple purpose, and then some go vision, mission, strategic priorities embedded in the organization. Keep it simple, move on. And I think these are some of the things we actually have a unique opportunity. I like what Stephan said before, not about the mother-in-law, but about the now I even lost my thinking in my own joke. But thanks for giving me some time to come back on this. So no, I think when we talk about this and we sort of talk about what is our purpose here and how do we drive that, right? So we are substitution industry. I don't think we should run away from that, right? But I think we have a perfect moment, to Stephan's point, to actually show that if you put too much pressure on any industry, now it's just us, then at some point in time, it's gonna have an impact. And that's what we are seeing now. We've had this conversation for some time. Generics was maybe a dirty word 10 years ago, 20 years ago. Everybody just expected it to be there. You can't be profitable. You have to just support and survive the system and so on and so forth. I think it's okay to ensure that you have enough profit to continue to reinvest in the future. And I come back to what I say first time is, don't underestimate what this industry actually delivers to healthcare. We're 70% of the volume in Europe. So I think some of that needs to be used, turn it into 2, 3, 4 priorities, and then really go hard at that. I don't think we are far away from that, Adrian. This is what we discuss every time we meet, right? It's just making sure everybody sort of signs up to that, continues to drive that. I think the sort of, how do you say this, a little bit unknown in the room is a bit this whole ESG thing that we talked about before. That whole sustainability, we saw it with wastewater coming, we see the green bill coming in, we see a lot of things coming in on that. That is a little bit untangible for probably all of us. And what does that mean for the industry? We've seen this come through other industries. You look at agriculture, pesticides and all of that, you've seen the impact. It's very likely to happen in medicines as well. So I think that's what we have to do, go back to basics somehow, Adrian, and then drive that forward. And then make sure that you keep us to the fire and keep us lined up. We will always have a little bit disagreeing agendas from company to company. But at the end of the day, we're here for the same reason. Markus said it many times today, patience.
Good. I think we're seeing that
James? No?
We'll say most probably last question. No. I think we do it. It's good. Yes, you want to have a...
Okay, so in my work in Medicines for Europe, I often have to talk with people who are working on pricing policies, on procurement, and explaining to them we need to incorporate security of supply, all the asks we've been talking about during this conference. We need to work on the environment and sustainability, and this needs to be also reflected in the policies. Policies need to change. They cannot stay the same, the policy framework, as has been for 30 years. And what often they challenge me back is, they say, okay, let's say now I am willing to discuss this with the industry. I'm willing to also, I see that there is a problem with how prices are regulated. There is no room, but let's say we are now doing this. How can you guarantee me that this will actually lead to more security of supply? And so now I would like to give this back to you. So what are you doing, or how do you see you can tackle this in the future? How are the performance indicators changing to also incorporate things beyond, so sustainability, security of supply, and so on?
It's a bit the chicken and egg, right? What comes first? No, but fundamentally, I think if you look at the root cause, why are we where we are? Because I always like to understand what is the root cause of the problem, right? And there's so much publications and data now. which are proven that one of the biggest issue is the price. Sorry to say, there's not a lot of vanilla around. It's simply competitive pricing, which we have seen over the last 10 years, right? So then I think let's start to fix first this, and then I think we're going to see that it has an impact, right? Because you're going to see more investments, you're going to see more investment in supply chain, in manufacturing, blah, blah, blah. But we need an economic viable framework. So there I would say, listen, let's go there. Let's try, let's hold hands. We work on the pricing models, and then I think you're going to see that this has a very nice impact on supply shortages. Because, you know, this data thing, we need actions now. We have enough data. We have enough information for many things, which we're discussing here for 2 days. But we need actions. And I think that's the call from the industry we need to do. We don't need more data, if you ask me personally. This is an excuse. We need now to move into actions. And Critical Medicines Act is there, which is perfect to start with. Let's start with this product. That would be but of course I'm happy to hear the panel.
I go back some years where I was meeting with local politicians, right? The quality of, the level of their understanding of our topics was not particularly high. And I mean, we were discussing like, it was a sort of a 101 type of conversation. Okay, the first chapter is this. I'm willing to come back, and then we discuss chapter 2, then chapter 3, and then eventually we can discuss about solutions, right? I think the data are there. I go back to the effort, which is not easy, to really be able to show where we are by collecting, but in a simplistic fashion, all the challenges we're facing as an industry, and we have a ton of examples. We have price evolution, new regulations, ESG, regulatory, you know, everything impacting, right? Cost of manufacturing. And then be able to distill simple messages for them to understand. And then have this cascading, which is not easy, right? Because you need to do it on a European basis, and then you need to collapse the individual trade associations to make sure that they're going to be hearing the same messages in 25 or hopefully as many countries, which is not easy. But even if we gather 10 countries, that would be important because they need to, top to bottom, right? Commissioners, members of commissions, politicians, patient association, we need to be able to tailor that message depending on who do we go to. And it has to be a concerted effort with clarity of who is messaging, involving general managers, site heads in countries so they can really talk to people who are there and they understand, right? And it has to be done on a consistent basis in a way that people understand the interlinkages which exist amongst initiatives which are taken independently in the value chain that we have. It was very complicated to do it in an association in a country in which I was. And then we attempted it, and then, as usual, there is entropy. But if we are able to convince each other within our industry that this is essential, that we cannot play country by country, and there is this willingness before. Otherwise, we'll continue to see the water, we'll continue to see individual interventions, and we'll be on the receiving side, and nothing is going to happen. I really would, and I'm not part of the Medicines for Europe, right, board, because some of you are, is to really find a way to connect us, not Medicines for Europe, with individual trade and get to this agreement of what is going to be changing, what is unnecessary, and how do we drive it with data that you were alluding to.
I mean, maybe, look, the data is clear and it's very easy. We are living in a market economy where you have a profit pool. This is where companies will go to get a bite of this pool, and that means supply. If you kill the profit pool, nobody will go supply because there's nothing to be earned. So it needs to be an attractive industry.
Good. I like this.
And it is an attractive industry. We do a lot of good.
Exactly. And part of us are so passionate about this industry that we are there for a long time and hopefully also for a long time more to go. So Elisabeth, first of all, I think thank you for the panelists, the CEOs here in the round. Thank you so much. I think it has been a great discussion and a lot of insight. I think a lot of common thinking. I think we are aligned, but also a lot of insights you have shared. I think I want to most probably close on a positive note before we have a last, of course, guest to welcome, which is fundamentally that you go home proud. That would be my simple message, because you do an amazing job, and I think we as an industry, we're really healthcare. I think you mentioned it, we are healthcare. Without us, there is no healthcare in Europe, and there is no single other industry which impacts the life of so many Europeans daily, every year, and I think since 30 years, because we have the 30 years anniversary. And I think we're here to stay. We're super resilient. I think this is the industry which is super resilient. There are challenges ahead, but let's never forget there's a huge opportunity. You saw it yesterday on the slide. There's an LOE landscape which is waiting for us, which is here to really drive value for patients. And I think we're here to really continue to drive access for patients and close this gap. There's still work to be done, and I'm so passionate, and I hope you continue to be passionate. I think you should see CEOs who inspire you and also the organization behind you to continue to work for this industry. So a big thank you. And I think we hand over. We have an introduction, Elisabeth.
Okay, so again, as Rebecca said, really thank you very much for your contributions. I think it was very interesting to see so many different perspectives and considerations. And I would like to hand over to Adrian for his closing remarks for the annual conference. Thank you.